Okay, so again, if alcohol withdrawals are a concern, then you want to watch, as I mentioned, clustering activities, nothing that's going to be like stimulate them too much neurologically, give support to the family. And there is no cure, obviously. The results that have occurred are irreversible. So you want to make sure that you just give the best support. And the shame here is, the real issue here, which goes back to, again, Melissa, I keep bringing up what you said, but obviously you have a weak family pattern. If you have alcoholism or enough alcohol abuse that this happened, right? That there's a weak structure to begin with. And now you have a child that's born with these issues. So now, what sort of support are they going to get? They're going to go into a DIFAS foster home system. Are they going to get as much stimulation that would allow them the best results? That's what we kind of come up against. So again, you want to give support. They do find that the family is still the best place for the child to be, but that ultimately, if the mother is that unsafe for the child to be with, then they try to give them to other family members, or they'll put them into the foster system, and they try to get them support as much as possible.
What's the point of hospitalizing these children? Because back when we went to children's specializer, quite a few of them
Yes.
that were withdrawal, and the parents were there. So what's the point if there's no cure? What's the point of?
Treatment of symptoms.
Yes, when they are.
What can?
Why are they hospitalizing? You're right. There are many that are there at Children's Specialized Hospital. They're being hospitalized. Go ahead, Melissa.
The different therapies they do, they try to get more function out of the kids.
And also, they're there for a very specific thing. They go through withdrawals for a long period of time. It's not just like a couple of days. It's weeks, and they actually have the signs and symptoms of irritability, jitteriness. They don't want to be touched. They have the high, shrill cry. Many of you might have even heard that or seen it. They don't want to feed, and when they feed, they don't feed well. So many of what they're doing at Children's Specialized is they're giving them therapies to enhance their development. They're trying to really assess what their areas of weakness might be, because we've already targeted that there's the potential there. And they're trying to get them to feed properly. So many times they have to be taught how to feed, because their soft swallow is very weak or poor, and they're not really getting a lot of nutrients too. So that's where speech therapy comes in, and they really do help with that also.
And maybe to check if there is any central nervous system affected with this.
Yeah, because there usually is something.
And a lot of them, they have these like cardiac anomalies, or I think they might have had surgery and they're rehabbing them from the
Yeah,
different
many do
anomalies.
have other comorbidities too, but even if they don't, the signs and symptoms of the withdrawal themselves, they put them onto they put them onto morphine to help with the withdrawal symptoms, so they're not so severe, so they're not at risk of seizures and a lot of these other things. But then that morphine needs to be weaned off, and they need to go through withdrawals from that too. So many times the rehab, that will be another focus of them being there, is that they're going to be, because they are on medications to help wean them off of the other stuff, and then they need to be weaned off of that and watched. Talib?
I was gonna say it's like going to the gym. When you could do, why would you go to the gym if you could do push-ups at home? But the gym has the facilities to do a lot
Well,
more.
that's it, and what if you
than the
can't do
resources.
push-ups at home because you don't have the room for it?
Yeah.
Like in this case, they don't have anyone that's gonna be supportive, might not have the capacity of anyone supporting them at home. And what I will say too about the family visiting and the mothers, because many people get upset, which we shouldn't, because we should not be judgmental. Many people say, oh, look at the mother's coming to visit, and she did this or this and that. We can't be that way as nurses. As healthcare providers, we have to be open and have to promote that bond. And they very, very, very rarely will the court say a mother cannot visit her child, especially if the child's in a safe place like a rehab facility where there's many people involved. Because they want to promote that bond, because ultimately, no matter how drug addicted or alcohol abused the mother is, ultimately the best place for that child is going to be with that mother, if they can get the mother healthy enough to take care of that child, and that bonding has to take place in order for that to occur. So whether you agree with it or not, that is the best.
The reference that I was actually making, point to is that this mother was there. She was participating in the child's care. She was
Good.
like very concerned,
Mhm.
there, mommy. So I'm saying, what was the point of her being here if there's no treatment that can be offered, and the mother is very much active?
No, they're doing treatment though.
Oh.
They're still giving meds, they're still monitoring that child for feeding, they're still probably, and quite honestly, she could be right there and be very involved, but might still have her own addiction issues too.
I was going to say there's also the element of the parent needs to be educated how to deal with this child in a different way than any other child that has no retardation issues.
That's right.
You know, and the parents need that support. Remember, we're not just there for the child, we're also there for the parents as
Could that be done in
nurses.
Could that be done into an outpatient facility, regular?
It probably could, but
The best
do
place
those,
is
do those facilities adequately exist, or will that parent go to those facilities?
And the other issue.
We have to look at every opportunity to help the patients as much as possible.
Yeah, and the other issue that comes up too with these patients is that they are highly irritable. They don't, they're not, you know, you brought up a good point here that made me think of something else too, because, you know, with a lot of infants, they sleep well, they feed well. You know, everybody says the easiest part is when they're first born. Well, not these infants. They're extremely difficult to soothe. They cry nonstop. So now you have a mother who obviously doesn't have good coping resources because, you know, she has these issues. Even if she's starting to get help, her coping resources are probably not the best.
We're gonna see more shaking syndrome.
That's right. The potential for abuse is so high in these situations that now, even though the mother might look great, they're in the facility taking care of the child, when they're home just by themselves with this child doing everything and the child won't stop crying and I can't get them and they're so irritable, the potential for these abuse, this is what happens.
I mean, they may have no family support either to hand off, oh, I'm going out. Like, okay, they may just leave the baby in the house and go out if they get fed up enough.
Yeah. Yeah, those have happened in those situations.
It could also be insurance things. Sometimes things, you have to be in the hospital to get them. They're not gonna give you outpatient care.
That's right.
Even just like the morphine, you're not gonna
That's right.
send them home with IV morphine.
That's right.
And then-
Mom's not gonna give them IV morphine
And
at
you're not
home.
gonna send a sick mother home.
That's right. You're not gonna send somebody with issues. That's
They're
right.
taking that morphine.
That's absolutely right. All those are good points.
And also, like, you know, Medicaid may pay for inpatient at children's specialized, they may pay for an hour of therapy a week at the house, which is
That's
not
right.
really enough.
That's
We just
absolutely,
want to see, we have assigned it, so they've otherwise like, not much, and then they said the therapy went on at like 7 in the morning, and we missed it, so.
yeah.
They basically, just nurses were just like kind of taking care of them all day. I didn't see any therapists that.
But I'm sure if you looked in their file, that infant is on meds. Do you know what I'm saying? I'm sure when it came to feeding times, there was a lot that had to be done to feed the infant, to soothe the infant. There's still, you know what I'm saying? Because nowadays, we don't keep patients in hospital who don't have some kind of medical need for it, obviously. You know, they're so quick to discharge that
But they get it into your GC.
they often do. They do, because they really have more NG, because they do try to take it out fairly early. But many of the patients there do, because they need to have, they don't really take the full amount they're supposed to, and the residual has to be given NG.
Well, the primary nurse that I was working with, the baby I had, she even said they will actually keep them there as long as they make progress.
Yes.
Then they send them home.
That's absolutely right.
So it's opposite of what we always think, oh, we want to get them out of the hospital fast, you know, but there, the longer they keep them, the better they're doing.
That's right.
And if they find that they're hit a wall where
Once
they're not
they
making any more progress, they're like, there's nothing we can